The content of this video, as well as the thoughts, views, and opinions expressed herein, belong to the presenter and do not necessarily reflect the views of Brigham Young University or the Church of Jesus Christ of Latter-day Saints.
Hello, everyone. My name is Kristine Fish. I'm a professor emeritus in the Kinesiology and Health Promotion Department at Cal Poly Pomona and co-director of a research lab where we study mind-body health. So we talked about the importance of adhering to the dietary guidelines in the Word of Wisdom, a predominantly plant-based diet, as part of taking care of our vessel. Today, let's talk about body composition, specifically body fat and weight and size and other components that make up our vessel. So weight loss efforts can be frustrating because there's so much conflicting information. Calories matter, types of food matter. Eat low carb, eat low fat. Eat breakfast, most important meal of the day. Do intermittent fasting, don't eat breakfast. Eat 3 meals a day. Eat small, frequent meals throughout the day. So much conflicting info. So my overarching purpose or my goal today is to sift through some of that info and provide evidence-based strategies for weight loss or fat loss. Let's first define body composition. So body composition simply refers to components of which our body is made up of: body fat, muscle, water, skin, and other lean tissue. For the purpose of this class, we'll use body fat, to refer to body composition. We have 5 objectives for today. So first, let's talk about problems with weight and size as measurements or indicators of our health. Many of you probably already know that weight and size are not always the best indicators of our health. For example, a super skinny model can have a relatively high % body fat and an unhealthy diet. And a larger, heavier person has a lot of muscle, very little body fat, and a super healthy diet. So in this case, it's the skinnier person who is unhealthy compared to the heavier person. Society's emphasis on weight and size as measurements of health is flawed. So in fact, one study found that almost half of overweight people were actually metabolically healthy, while 30% of normal weight people were not. Yet there continues to be societal pressure to be a certain size and look a certain way. Metabolic health, by the way, refers to how well your body generates and processes energy in response to food. So what evidence do we have of this societal pressure to be thin? Well, we have a problem with eating disorders, not just in our country, but worldwide. Rates of cosmetic procedures, including cosmetic surgery, continues to rise. And studies document the presence of weight bias, which contributes to the pressure to be thin. So let's first briefly address eating disorders. What do you think? Have eating disorders gone up? The prevalence of eating disorders gone up or gone down, or has it stayed the same? What do you think? Between 2000 and 2018, the prevalence of eating disorders more than doubled worldwide, and there was a 107.4 increase in eating disorder diagnoses from 2018 to 2022, only a 4-year period. Although an eating disorder is technically considered a mental health issue, there's usually some form of pressure to be thin. Cosmetic surgery. During the pandemic, there was a 10% increase of cosmetic surgery. The rates don't appear to be going down now that we're through the pandemic. The Aesthetic Plastic Surgery National Database reported that Botox has increased by 54% and filler treatments are up by 75% since 2019. There should be no guilt or shame for getting Botox or fillers or any cosmetic procedures. I mention this simply to illustrate there is a pressure, sometimes subconscious pressure, to look a certain way. Is this pressure experienced only by young girls or young women? No, not at all. In one plastic surgeon's office, they looked at simple frequencies and percentages, so no statistical analyses were run. They found that between 30 and 54 years was the average age for women to get their first cosmetic procedure, and the most common age range for those receiving the most procedures. But in a nationwide survey in the U.S., it's women between 51 and 70 that have the most cosmetic procedures. These stats are from 2022. Again, there's no pointing fingers at all for those who have had cosmetic procedures. I know some women who feel fantastic after a procedure, women and men. This is simply to show that the pressure to look a certain way is real, and it's prevalent not just among young girls. Elder Holland addressed young women in General Conference in 2005, but he also addressed adult women in this conference. He said, I mention adult women because, sisters, you are our greatest examples and resource for these young women. And if you are obsessing over being a size 2, you won't be very surprised when your daughter or the Maya maid in your class does the same and makes herself physically ill trying to accomplish it. What about weight bias as an indicator of societal pressure? Weight bias is a term used to describe negative attitudes and beliefs about people based on their weight and size. Unfortunately, hundreds of studies indicate that weight bias is prevalent among all ages, children, teens, adults, and older adults, and among both men and women, and among both thin and overweight people. So according to a 2021 study, 42% of U.S. adults have experienced some form of weight bias. Unfortunately, healthcare professionals are not immune to this bias, even those specializing in the field of obesity. In one study, physicians viewed patients who were obese as less self-disciplined and more quote-unquote annoying compared to thin people. Also, the physicians reported less desire to help them. Cognitively, of course, we know that our self-worth is not dependent in any way on the size of our body. But I think it's important to understand that weight bias can subconsciously cloud our perception of ourselves and others. Susan Tanner, former Young Women General President, said, "The Lord wants us to be made over, but in His image, not in the image of the world." The societal pressure to look a certain way and be a certain size can be incredibly dangerous and detrimental to not only our self-confidence, but to our physical, emotional, and spiritual health. Regarding self-confidence, Elder Holland said in 2021, the Great Depression we now face has less to do with the external loss of our savings and more to do with the internal loss of our self-confidence. So the body acceptance movement is a movement that promotes acceptance of all bodies, regardless of size, shape, skin tone, gender, and physical abilities. At the far end of the spectrum, there are those who completely accept their bodies, even if their bodies are in an unhealthy state. There are 13 types of cancer and more than 200 other health conditions that are related to obesity. I love the idea of accepting our vessels, no matter what. But we have to be careful when acceptance is at the expense of our health. At the far end of the other side of the continuum, or the spectrum, are those who place way too much emphasis on weight size and looks, which exacerbates weight bias and can precipitate obsessive compulsive tendencies and anxiety issues. How many of you know someone or have ever come across someone who obsesses too much about their weight or size? Keep in mind that the vessel that houses your spirit does not determine the value of your spirit. But at the same time, we want to take good care of this amazing gift that our Heavenly Father provided to us. Let's talk about some metrics or numbers other than size and weight that are measurements of our physical health. So I'm going to provide some empirical data that documents numbers associated with ideal health and numbers associated with chronic disease. But there should not be any guilt or shame involved when it comes to our amazing vessels. So I don't want anyone feeling bad about your body because your numbers aren't ideal. My numbers are not ideal. Again, our self-worth and value as a child of God has zero to do with the size, shape, and weight of our vessel. But it's important to do what we can to take care of that vessel. So if you see that your numbers are not in the optimal health category, maybe set a goal to adopt some habits that will ultimately improve those numbers. So these are some standard metrics indicative of relative risk for developing chronic disease. So everyone should probably know these metrics. Do you know your numbers for at least 2 or 3 of these metrics? Unfortunately, the first metric listed tends to get most, if not all, of our attention, but it's the least important metric. I don't think we should completely ignore or throw out weight because it's often tied to the other metrics. But we're not going to talk about weight today. The most important metric is the second one listed, percent body fat. The most accurate methods for calculating percent body fat require special equipment and are dependent on someone else completing the assessments. And the accuracy of these tests is dependent on the skill of the person performing the test. So we're not going to talk directly about percent body fat. Let's talk about the last 4 metrics, which indirectly assess body fat. None of them are perfect. The only way to know your true percent body fat is to kill you, take all your fat out, and weigh it. But these are quick and easy measurements to help you understand where you're at in terms of your body composition or body fat. Let's first talk about BMI or body mass index. BMI is a way to estimate body fat based on your height and weight. What's the ideal BMI? The largest studies globally have found that having a BMI from 20 to 25 is associated with the longest lifespan. But if we look at all the best studies with the longest follow-up together, it looks like a BMI of 20 to 22 is ideal. That would be about between 124 to 136 pounds for someone who is 5'6". So even within a normal or optimal BMI, the risk of developing chronic type 2 diabetes, obesity, and several types of cancer, the stats start to rise even starting as low as a BMI of 21. So BMI of 18.5 and 24.5 are both considered within the ideal range, but a BMI of 24.5 may be associated with twice the heart disease risk compared to 18.5, but they're both in the ideal range. A global BMI mortality collaboration was formed and charged with the task of reviewing data from more than 10 million people from hundreds of studies in dozens of countries, the largest evaluation of BMI and mortality that I'm aware of. The results were clear. Being in the overweight and obese classifications are associated with a significantly greater risk of dying prematurely. So although BMI is not perfect, it still seems to be fairly accurate in terms of predicting death and disease for most people, more so than weight. BMI is not a perfect metric because it doesn't take into account muscle mass and fat distribution. Someone with a BMI in the normal category may be at greater risk of disease, more so than someone with a BMI in the obese category, because the normal BMI person might have more abdominal fat than the obese person. And the obese BMI person might have a ton of muscle mass and a lower percent body fat than the normal BMI person, similar to the example I provided a minute ago with the model and a bodybuilder. So the good news, here's the good news. The good news is a meta-analysis, statistical analysis of multiple studies, found that the optimal BMI range for the lowest mortality for older people, 55 and older, were those in the overweight category with a BMI of 25 to 29. So based on this meta-analysis, it appears that the older we get, a slightly higher BMI is not as strongly associated with disease compared to younger people. This is not the case once someone gets into the obese category, which is 30 and above. This pertains to those in the overweight category of 25 to 29. So how do you calculate BMI? There are tons of BMI calculators on the internet. NIH, CDC, WebMD, they all have BMI calculators. You just need to input your height and weight in inches and it will give you your BMI. Again, one of the problems with BMI is it doesn't take into consideration fat distribution. Waist circumference has been shown to be superior to BMI with the estimating deep underlying belly fat, which is the most dangerous type of fat. There appears to be an increase in mortality risk with wider waistlines, even in people with the same BMI. So someone who is not overweight, according to their BMI, but they have excess fat around the middle, can have up to twice the risk of dying prematurely compared to someone who falls in the obese category with a smaller circumference. So this may be especially important for older women who lose about 13 pounds of bone and muscle as they age from 25 to 65, while quadrupling their visceral fat stores. Men tend to only double. Thank you, menopause. Visceral fat is found around your midsection and is dangerous fat. So even if a woman doesn't gain any weight, she may be gaining fat as she ages. Here's a study showing that increased abdominal fat measured by waist circumference was related to a higher risk of premature deaths independent of BMI. It didn't matter what their BMI was. What's the ideal waist size regardless of height? Well, increased risk of metabolic complications starts at 31.5 inches in women, I know, and 37 inches in most men. It was interesting that Asian men tend to have health complications with slightly lower numbers. The benchmark for substantially increased risk starts at about 34.5 inches for women and 40 inches for men. Mortality rates shoot up by 50% in men with a waist of 43 inches. And women suffer 80% greater mortality risk at 37.5. The good news is the riskiest fat is the easiest to lose. Your amazing vessel is smart enough to lose visceral fat around your abdomen first when you lose weight. Waist to hip ratio, or WHR, is the ratio of a person's waist circumference to their hip circumference. It's calculated by simply dividing your waist measurement by your hip measurement. Or you can find lots of calculators online. Just search for waist to hip ratio calculator and type in your waist and hip measurements in inches. What's the ideal waist to hip ratio? According to the World Health Organization, a healthy WHR is less than 0.85 for women and less than 0.9 for men. And just like waist circumference, studies suggest that WHR is a better predictor of chronic health problems than BMI. Which one is better, waist circumference or WHR? I wasn't able to find research studies that compared those two. But if I had to guess which one is better, I'd probably say WHR. A physician at Cedars-Sinai in LA developed a method called relative fat mass, or RFM. It's the ratio of height to waist circumference. So BMI is based on height and weight, WHR is based on waist and hip circumference, and RFM is based on height and waist circumference. So it was actually validated in over 3,000 patients. As with BMI and WHR, there are RFM calculators online. Just type in your height and waist in inches. So which of these numbers should be taken into consideration? All of them, to get the most comprehensive picture, but know that they're not perfect. Now that we've talked about ways to indirectly measure our body composition, let's talk about issues with trying to lose weight using popular fad diets. So weight is not the most important measurement of body composition, as we talked about, but it should be no surprise then that weight should not be the sole determining factor of whether a diet or program works or is effective. I have a friend who lost weight by eating candy corn. You know, the candy corn at Halloween? She lost weight and gained it back, but she lost weight by eating nothing but candy corn. You can lose weight by dramatically restricting your caloric intake with highly processed, high sugar diet, as my friend did. You can lose weight by restricting your carb intake. You can lose weight by restricting your fat intake. There's tons of ways you can lose weight, but 3 key factors that I believe are an absolute must regarding the quality of any weight loss program are: 1, the nutrients, the quality and quantity of nutrients. Does the diet provide the maximum amount of nutrients to optimize the functioning and health of your body? Number 2, the sustainability of the diet. Can you eat like this for the rest of your life? Number 3, body fat should be taken into consideration, not just weight. Body fat is much more important than weight in terms of your health. So here we go. I'm stepping into dangerous territory. I've noticed that some people have very strong opinions and feelings about the diet they follow to lose weight, such as a keto or low carb diet. So if you're a hardcore low carb believer, I'd like to ask that you keep an open mind. I'm going to provide some empirical data from research studies, and you do with it what you will. You have an amazing brain to interpret this information, and you have your agency. Are there studies that show the keto diet works? When I say works, I'm referring to simply losing weight. Of course, in fact, there are some studies that show people can lose more weight quicker on a low-carb diet than a high-carb diet. But remember, weight is the least important metric when it comes to your health. Body fat is the most important. Let's take a look at some research. Based on a review of studies, within the first 6 to 12 months of starting a keto diet, there were decreases in blood pressure, decreases in triglycerides, increases in HDL, the good cholesterol, and decreases in weight. However, the benefits are not generally seen after 12 months or sooner. So despite the diet's favorable effect on HDL, there were increases in LDL and VLDL, 2 types of bad cholesterol, which results in increased cardiovascular risks. And the dietary restrictions required to sustain ketosis may lead to low sustainability and nutrient deficits. Key findings of another comprehensive review of the keto diet are: keto diets may be especially unsafe for women who are pregnant or may become pregnant. Low-carb diets are linked to a higher risk of neurotube defects in the baby, even when the women take folic acid. And higher protein keto diets could cause faster kidney failure in those with kidney disease. But what if you're not pregnant, don't plan on becoming pregnant? And what if you're not a patient with kidney disease? Well, in addition to raising LDL cholesterol, the bad cholesterol, restricting carbohydrates skews the diet toward cancer-causing, heart disease-causing, and kidney stone-causing foods. A keto diet is usually very high in saturated fat, which is found in all animal foods. So it's indisputable that too much saturated fat is associated with a gazillion problems. Thousands of high-quality studies show that too much saturated fat is unhealthy for us. Typical keto foods are high in saturated fat, and those foods have been linked to an increased risk of heart disease, cancer, diabetes, and Alzheimer's. There's a lot of research pertaining to the keto diet and health problems, but let's stick with the keto diet as it pertains to weight loss and fat loss. So the keto diet is based on the carbohydrate insulin model of obesity. The underlying theory is that keto diets have a metabolic advantage. Researchers who were supporters of the keto diet found in their own studies the exact opposite. Keto diets actually put you in a metabolic disadvantage and slow the loss of body fat. The weight might come off, but not the fat. How much does fat loss slow down on a low-carb diet? Well, one study found that cutting 800 calories a day of carbohydrates from your diet resulted in losing 53 grams of body fat. But if you cut the same number of fat calories, you lose 89 grams of fat a day, which is 80% more. Same number of calories, but more fat loss on a low-fat diet compared to the low-carb diet. In another study, after 6 days on a low-carb diet, subjects lost 4 pounds. It's pretty good, 4 pounds in 6 days. On the low-fat diet, they lost less than 3 pounds. You can see why the low-carb diets are so popular. But the low-carb group lost mostly lean mass, water, and protein. When you eat carbohydrates, your body bulks your muscles up with glycogen for quick energy. Those glycogen stores drain away in a low-carb diet and pull water out with it. And ketones also need to be flushed out of the kidneys, which pulls out even more water. So the result is high water loss. If we look at all the studies together, there's more fat loss from those who consume a low-fat diet, even when they eat the same number of calories as those who consume a low-carb diet. Another popular dieting method is intermittent fasting or time-restricted eating. Studies have shown that there does appear to be two significant benefits of intermittent fasting. One, people tend to consume fewer calories, and two, they avoid nighttime eating, which has been shown to impede weight loss. But studies also show if you're starving when you eat, you're more likely to eat more calories. So I don't recommend eating breakfast or any meal if you're not hungry. Eat when you're hungry. But yes, there are several benefits to intermittent fasting. So here's a physician who created a well-advertised popular diet. I won't say his name. His main premise is that lectins are bad. These are some high lectin plant foods. Beans and legumes have a lot of lectins. So people who eat tons of beans and legumes should be unhealthy, have weight issues, and have poor longevity, according to this physician. But the exact opposite is true. As Dan Buettner points out in his Blue Zones work, lectin-packed foods are the cornerstone of diets of all the healthiest, longest-lived populations on the planet. Legumes in particular are a common food among these populations. And if lectins are bad, then people who consume whole grains should be unhealthy and have poor longevity. But the exact opposite is true. Whole grain intake has been shown to be associated with a reduced risk of coronary heart disease, strokes, cancers, and mortality from all causes put together. People who eat whole grains tend to live longer and get fewer respiratory diseases, infectious diseases, diabetes, etc. This physician also says that nightshade vegetables, which include tomatoes, are bad for you. He actually uses the term deadly. But a 2014 study found that women who drank 280 milliliters, which I believe is about a cup and a half, of tomato juice per day for 2 months while maintaining their normal diet and exercise routine saw a significant reduction in body weight, body fat, waist circumference, and BMI. The tomato juice also increased lycopene levels. Lycopene is an antioxidant that may help reduce the risk of heart disease and some cancers. Food for thought. You interpret this how you'd like, but most nightshade veggies grow underground. Take a look at what Heavenly Father said about whether or not we should eat food that grows underground in verse 16 of D&C 89. So there's a gazillion more fad diets we could talk about. The weight loss industry was estimated to be $90 billion last year alone in 2023. We spend a lot of money searching for the magic pill to lose weight, and people make a lot of money with proposing their magic pills. Let's briefly talk about implications of the word of wisdom for weight loss and body composition. As I talked about yesterday, it's clear that the dietary guidelines in the Word of Wisdom include plenty of whole, non-processed or very little processed plant foods and limited meat. Can you lose weight, or I should say improve body composition, on a plant-based diet? Absolutely. This particular study involved a literature review of plant-based diets. The author found that plant-based diets had much higher level of nutrients than other weight loss diets. And these plant-based diets were definitely found to be effective in terms of weight loss. Yesterday, I also mentioned that foods identified in the Word of Wisdom are likely not highly processed foods. This article was also a review of research studies. 4 out of 5 studies reviewed found that a higher consumption of ultra-processed food was associated with overweight and obesity. Heavenly Father tells us to eat meat sparingly, if at all. Multiple studies have found a link between meat consumption and obesity. In 2009, a study found that people who consumed the highest amount of meat were 27% more likely to be obese and have higher waist circumferences. The study also found that higher meat consumption was associated with higher BMI and waist circumference. In 2014, a study found that people who ate the most red meat and processed meat were 37% more likely to be obese than those who ate the least amount of meat. So there are benefits in terms of weight loss and weight control associated with the dietary guidelines and the word of wisdom. Which appears to be the worst type of meat when it comes specifically to weight control? What do you think? Beef, poultry, chicken or turkey, or fish? Actually, it's poultry appears to be the worst. Even just an ounce a day, as shown in one study. That's like a single chicken nugget or one chicken breast every 10 days. Let's talk about evidence-based strategies for improving body composition, specifically weight loss, and more importantly, fat loss. I wish I could tell you about this secret magic pill that melts off fat, and that's been validated in research studies, but I can't. First, I like to provide an analogy. In a dart throwing competition, the more darts you get on the board, the more points you earn. And the more points you earn, the better chance you have of winning. So the more things you can do, the better chance you have of losing weight or improving your body composition. So some of the things I'm going to tell you are not very powerful by themselves. There's a synergistic effect when you incorporate 2 or 3 or 4 or more. It's usually not one dart that's going to get you there. One powerful dart to get you in the habit, if you're not already, of eating less calorie-dense foods. Isn't weight loss just about eating less and moving more? And isn't a calorie a calorie? Well, many of you may already know this, but there's a big problem with the notion that a calorie from one source is the same as from another source. Same thing with carbs. The idea that the number of carbs in oatmeal is the same as what's in a donut is so misleading for so many reasons. I'm going to use the example that Dr. Micah Greger used in one of his presentations. If a calorie is a calorie, this means that the overconsumption of calories from carrots would be no different than the overconsumption of calories from soda. He used Coke as an example. So it may be true that in a tightly controlled laboratory setting, 240 calories of carrots, which is about 10 carrots, would have about the same effect as the 240 calories in a bottle of Coke or soda. But we don't live as lab rats in a tightly controlled lab setting. This comparison is not accurate in the real world. You could drink those liquid candy calories, as he calls it, in less than a minute. But eating 240 calories of carrots would take you more than 2.5 hours of sustained constant chewing. Not only would your jaw get sore, but 240 calories of carrots is like 5 cups. You might not be able to fit them in your stomach because most stomachs have a max of 4 cups of food. So once our stomach gets full, stress receptors tell you when you've had enough, but different foods have different amounts of calories per stomach full. This is the concept of calorie density, or the number of calories in a given amount of food. So as I mentioned, the average human stomach expands to fit about 4 cups of food. So a single stomachful of strawberry ice cream, which is 4 cups of ice cream, I know that's a lot. That's if your stomach was completely empty. It could max out your caloric intake for the entire day. To get those same 2,000 calories from strawberries, you'd have to eat 44 cups of strawberries. That's 11 stomachfuls. Some foods are impossible to overeat. They're so low in calorie density, you just physically couldn't eat enough to maintain your weight. In a lab, a calorie is a calorie, but in real life, it's not. It's far from it. Researchers in Hawaii put people on a diet with unlimited quantities of fruits and vegetables, whole grains, and beans. So the people lost an average of 17 pounds in 21 days. Their calorie intake dropped by 40%, but not because they were eating less food. They lost 17 pounds in 3 weeks eating more food. Here's a list of the lowest calorie-dense foods. Notice these are plant-based foods, the type of food that was recommended by Heavenly Father in the Word of Wisdom. Before I give another dart to throw at the target, so to speak, which characteristic do you think was found to be the most satiating when several common foods were assessed for their ability to satisfy appetites or make people feel full? The foods with the most fat, the most protein, the most calories, or the most water? It was foods that contained the most water that made people fill up faster. That was the number one predictor of satiety. So my second recommendation is to preload with foods that have a high water content. Preload meaning eat immediately before your meal. What are water-rich foods? Non-starchy vegetables are at the top with more than 90% water by weight. Examples of non-starchy veggies are cauliflower, asparagus, mushrooms, cucumbers, carrots, and celery. Most fresh cut fruit comes next, coming in at around the 80+% water content. Starchy vegetables, whole grains, and canned beans are mostly 70% water content. Animal foods are next, and highly processed foods are at the bottom. Other studies on preloading show that eating about 1 cup of high water food before a meal decreases subsequent intake by about 100 calories. So to get a negative calorie effect, the preloading food would need to contain less than 100 calories per cup. What about a large apple before a meal? People consumed 300 calories less. We see the same thing giving people vegetable soup as a first course. People ate fewer calories. One study that tracked people's intake throughout the day found that overweight people not only ate less when they preloaded with vegetable soup, but they ate an extra 100 calories less at dinner too, 7 hours later. Even just drinking 2 cups of water immediately before a meal caused people to cut about 20% of their calories out of the meal. In another study, overweight men and women who drank 2 cups of water before each meal lost weight 44% more than those who did not drink water before their meals. Consuming vinegar on a daily basis is another strategy or dart you can throw at your target. There are a few small studies that showed mixed results, but looking at all the studies together, it appears that consuming vinegar may help with weight loss. There's an enzyme called AMPK in vinegar that helps kickstart your metabolism and actually mimics endurance exercise. Okay, vinegar should not replace exercise, but when vinegar, acetic acid, is absorbed and metabolized, you get a natural AMPK boost. I couldn't find a study comparing the different types of vinegar with regards to weight loss, so I don't believe it has to be apple cider vinegar or a certain type of vinegar to lose weight. But speaking of apple cider vinegar, a randomized double-blind placebo-controlled trial, the best type of study, was conducted over 3 months on the effects of vinegar intake on the reduction of body fat in overweight men and women. People drank a daily beverage containing apple cider vinegar, or a controlled drink developed to taste the same as the vinegar drink, but it was prepared with a different kind of acid. So it didn't have actual vinegar in it. After 3 months, the fake vinegar group actually gained weight, whereas the vinegar group lost a significant amount of weight and body fat. A little vinegar every day led to pounds of body weight loss without removing anything from their diet. Next dart or strategy. 100 overweight men and women were divided into 2 groups. One group consumed a 1/4 teaspoon of garlic powder a day, and the second group consumed a placebo pill. Both groups kept their same diet. So those who took the garlic powder lost about 6 pounds of body fat over 15 weeks. There definitely was an association with garlic intake and weight loss. Here's another dart for you. A meta-analysis showed weight loss is associated with a 1/4 teaspoon a day of black cumin. Just an FYI, black cumin is mentioned in the Old Testament, in Isaiah, and there's over 1,000 papers published in the medical literature on black cumin. Some reporting it's amazing. Some reporting amazing results like dropping cholesterol levels as much as a statin drug. What about regular cumin? Well, half a teaspoon of regular cumin at both lunch and dinner over 3 months resulted in about 4 more pounds and an extra inch off their waist compared to the control group. What about ginger? Half a teaspoon of ginger powder and a cup of hot water resulted in increased metabolic rate even 4 hours after drinking it compared to the control group. There are over a dozen studies starting at just a quarter teaspoon of ground ginger a day that show significantly decreased body weight. I should mention that many of these studies show people lose weight, but not so much body fat. Let's go back to the Coke versus carrots example. Even if you chewed for hours all those carrots, a calorie may still not be a calorie because it's not what you eat, it's what you absorb. That's where fiber comes in. If people increase their fiber intake even to just the recommended minimum daily amount, which is 25 grams, they start losing weight because they experience about a 10% drop in caloric intake. For example, apple juice is basically apples minus the fiber. You could drink a bottle of apple juice in a couple of seconds, but to get the same number of calories, you'd have to eat about 5 cups of apple slices. But it's not just a calorie density thing. Fiber never gets absorbed, so it can act as a carrier to dilute or even eliminate calories out the other end. What are high fiber foods? I'm sorry to sound like a broken record for those who remember what a record is. It's whole food, it's whole plant-based foods. A note about nuts: almonds, pecans, and walnuts have more fiber than other nuts. One last note about high fiber foods as they pertain to weight loss. You can eat fiber-rich whole grains for dinner, and it can cut your caloric intake more than 12 hours later at lunch the next day, according to one study. You feel full 100 calories quicker the following day because by then your good gut bugs are feasting on your dinner from the night before and causing a decrease in your appetite. Number 7, limit protein. It is true that plant-based meals are less fattening because they cause less of an insulin spike. Animal protein causes almost exactly as much insulin release as pure sugar. For example, just adding some egg whites to your diet can increase insulin output by as much as 60% within 4 days. And fish may be even worse. Increases in insulin signals the body to store incoming food as fat instead of burning it for fuel. Why would adding tuna to mashed potatoes spike insulin levels, but adding broccoli instead cut the insulin response by about 40%? It's not the fiber, since giving the same amount of broccoli provided no significant benefit in this particular study. It appears to be that decreasing consumption of branched-chain amino acid, which is found in meat, improves metabolic health. In one study, people who restrict their protein intake ate more calories a day, but they actually lost more body fat. Restricting their protein enabled them to eat more calories, while at the same time they lost more weight. But they were just eating the recommended amount of protein. What's the recommended amount for adults? 46 to 56 grams per day, yet the average American consumes about 80 grams of protein per day. Okay, so eating less calorie-dense foods, preloading with water-rich foods, consuming vinegar and certain spices, eating high-fiber foods, and limiting protein consumption all point to the next dart, which is the most important dart. Dr. Greger searched through his tons of randomized controlled trials, high-quality studies, and the single most successful strategy for weight loss that he found is eating a diet of whole plant foods. This works better than anything else he studied. We've known for years that those eating predominantly plant-based diets weigh, on average, about 30 pounds less than the general population. In 2017, a group of New Zealand researchers divided up a group of overweight people into an intervention group and a control group. The control group received standard medical care, and the intervention group received semi-weekly classes offering advice and encouragement to eat a whole food, plant-based, low-fat diet, and they were given vitamin B12 supplements. After 12 weeks, there was no significant change in the control group with only a 0.4 BMI reduction, but there was a 4.4 BMI reduction in the plant-based intervention group. They lost an average of 19 pounds by the end of the 3-month study. Resting metabolic rate among predominantly plant-based eaters has been shown to be a minimum of what % higher than those who consume animal and processed foods? What do you think? 3, 5, or 10% higher? 10% higher or more. So a higher metabolism means burning more calories a day without doing a thing. Here's another dart. Number 9, eat calories earlier in the day. Can the exact same foods eaten at different times of the day have different effects? Yes. So even if you eat the same amount, and even if you absorb the same amount, a calorie may still not be a calorie. It's not only what we eat, but how and when. For example, the same number of calories at breakfast have been shown to be significantly less fattening than the same number of calories at dinner. Same calories, different weight loss. It's recommended to stop eating after about 7 p.m. and to eat higher calorie meals earlier in the day. The same food eaten at night is literally more fattening than eating the exact same food during the daytime. Last dart. I've focused a lot on dietary recommendations for improving body composition or body fat, but body composition doesn't just include body fat. It includes muscle. I can't close without mentioning the importance of exercise, but specifically strength training, also called resistance training. Women especially don't typically think of strength training as part of a weight loss effort. But muscle mass is 3 times as metabolically active as fat. But muscle mass is 3 times as metabolically active as fat, meaning it takes 3 times as many calories to maintain a pound of muscle as it does a pound of fat. So muscle loss, it's called sarcopenia, can begin as early as your 30s, but one study showed as early as mid-20s, depending on the degree to which the person was sedentary. So on average, people lose 3 to 5% of their muscle mass per decade, but the rate can vary. Some researchers estimate that people between the ages of 60 and 70 have lost 12% of their muscle mass, while those over 80 may have lost 30%. In people over 65, muscle loss can progress pretty quickly, causing them to lose up to 80% of their lower body strength. 80% of their lower body strength. But it all depends on how much they're using their muscles. Muscle loss is not inevitable. There's a lot more that I can say about weight control and improving our body composition, but here are the key takeaways for my presentation. Key takeaway number 1. Take into consideration multiple metrics. Weight is the least important, and waist circumference or waist to hip ratio may be the most important in terms of your health. But take into consideration all the metrics. Don't place too much emphasis on weight. Key takeaway number 2, throw as many darts as you can on a regular and consistent basis while keeping in mind that the size and shape of your vessel has nothing to do with the value of the spirit that the vessel houses. Takeaway number 3, consider adopting, if you haven't already, a whole food plant-based diet. Of course, our vessel itself doesn't add value to our self-worth, but doing what we can to take care of our amazing vessel is critical to our journey in this life. If your metric numbers are not great, start with a baby step and throw one dart at the target, then two, then maybe three. The most important thing is to adopt the habits that will improve your body composition, which will improve your health and decrease the risk of disease and illness. I believe that taking care of our vessel, which largely involves following the dietary guidelines of the Word of Wisdom, is part of, quote unquote, living the gospel in the name of Jesus Christ. Amen.